Hello and welcome to the first episode of Medical Topics in 2 minutes with me, Dr. Yaman Shihabi. Today, I would like to raise the awareness about an important topic in medicine, which is hypertension or high blood pressure. First of all, hypertension is the major risk factor for strokes and MI, myocardial infarction, and it's usually asymptomatic side. Screening is vital. In definition, what is hypertension? Actually, we define hypertension as a raised amount, blood pressure amount, over the 139/89 millimeter Hg. And what these two numbers refer to, actually the first number is a systolic blood pressure, which is when the heart is contracting, it generates a blood pressure, and this blood pressure is measured as a number. This is the systolic blood pressure. The other number is diastolic blood pressure when the heart is relaxed. What are the classifications or the reasons for hypertension? Usually we have two classifications for that. The essential hypertension, which represents the great majority of the percentage of the reasons or of the causes of this disease, which is unknown origin. The other remaining 5% is usually to secondary reasons, which usually refer to or due to renal diseases such as glomerulonephritis or pyelonephritis or polycystic kidney diseases or systemic sclerosis, for example, or renovascular disease, and etc. Some others are endocrinological disorders such as acromegaly, Cone syndromes. We will go over these topics later on, Cone syndromes and Cushing, and of course it could happen with pregnancy as well, with the usage of steroids. What could be the symptoms and signs of hypertension? As we mentioned earlier, that this is an asymptomatic disease. Whom to treat and what drugs used to treat this disease? Actually, we used to treat patients according to the number of or the amount of high blood pressure measured. If it's too hypertensive, then drugs must interfere in this case. But if he is moderate hypertension, then we can depend on modification of his lifestyle. For example, losing weight, low-fat diet, stop smoking, stop alcohol consumption, and doing a lot of exercises. These are a lifestyle modification. What drugs actually used to interfere with treating hypertension? Usually we used to use calcium channel blockers such as nifedipine, for example, and we can use like thiazides, which are diuretics, for example furosemide, one example of that, and ACE inhibitors. And if he is sensitive for that, we can use angiotensin receptor blockers such as losartan and so on. And here we come to the end of this medical topic in 2 minutes. Have a good day.